I have a patient and I've seen her for about maybe 2 or 3 years, I don't know. She's really smart and she came to see me because she was afraid that she had dementia and her mother had Alzheimer's. She said, I'm losing my mind, and I checked her thinking and her thinking was fine, and I got an MRI and her MRI was fine, and I got her labs and that was good. And I said, well, exercise, Mediterranean diet, and think hard. She came back 6 months, a year later, doing okay. I rechecked her thinking probably after a year and her thinking had improved, and then I did it again. So another year went by. And that would have been around, I think she used to come in February. It's September now. She came back and she came this time on her own, and she's like, I don't really think there's anything wrong with my thinking. None of my friends do. None of my close friends have said it, and none of my husband's close friends have said it. But, my husband keeps saying that I have something wrong with me and that I'm sick and that I have dementia. And her cognitive tests are good, and they improved a little when we put her on Mediterranean diet and exercise. So she started telling me more about her husband, and he's under a lot of stress. He's actually always been very controlling. And then she just kept going on and on about him, and I asked her, is he gaslighting you? And she lit up. She's like, well, I think that. I was talking to her before that about, well, maybe he has wrong ideas, and I was explaining how you can get wrong ideas. I didn't say the word delusion, but all the delusions I was talking to the patients about, like you don't realize that your kids are taking advantage of you, or you don't realize that your child is taking drugs, or you don't realize your spouse is having an affair, or, you convince yourself of certain ideas, and you can convince yourself of a wrong idea that your wife is having memory problems, but benign wrong ideas. Anyway, I'm not making that diagnosis, but she's cognitively normal.